Hello, my name is Varghese Kirakudan, and the topic I chose for my research is soft tissue sarcoma. And of the multiple types of soft tissue sarcoma, I chose rhabdomyosarcoma as my research topic. Soft tissue sarcomas are malignant tumors which is found in the soft tissue or the fibrous connective tissue of the human body. These tissues can include fat cells, muscle cells, blood vessels, etc. The most common symptom of soft tissue sarcoma is a lump pushing against an anatomy or pain specific to the site of onset. There are over 50 types of soft tissue sarcomas, of which rhabdomyosarcoma is one of the most commonly found among children. Rhabdomyosarcoma is a tumor of muscular origin, and it has a skeletal cell morphology to it. The presence of rhabdomyoblasts is necessary to determine if the soft tissue sarcoma is a rhabdomyosarcoma. Since it's most commonly found among children, the lump or caused by the rapidly dividing cells can be easily mistaken as a normal growth, and in some cases it can be overlooked. The most common site of onset is head and neck, and these sites of onset are the most easier to find too, hence since due to the anatomy constraints. These tumors usually protrude outwards and push any sort of anatomy present in the head or neck, for example the eyes. It can cause the eyes to bulge out. Symptoms for rhabdomyosarcoma is a lump or pain. It can cause obstruction if it's in the mouth, or it can cause obstruction to bowel movement. It can cause difficulty urinating, and it can even cause bleeding in some cases. The most commonly affected demographic is children under the age of 10. About 90% of all the cases is under the age of 25, and of which 60 to 70% is under the age of 10 years of age. It is still unclear what causes rhabdomyosarcoma, but there are genetic associations to pre-existing conditions such as Lee-Fraumeni syndrome, Beckwith-Wiedemann syndrome, neurofibromatosis type 1, Costello syndrome, and Noonan syndrome. People with these genetic disorders are at a higher risk of getting this rhabdomyosarcoma. There are some acquired DNA mutations which can cause rhabdomyosarcomas. This includes exposure to certain chemicals, or if you're undergoing radiation treatment for other types of cancer, it can also cause the DNA mutations which can cause rhabdomyosarcoma. There are 3 types of rhabdomyosarcomas: embryonal, alveolar, and pleomorphic rhabdomyosarcoma. Embryonal is further classified into spindle cell, botryoid, and anaplastic rhabdomyosarcoma. This accounts for about 50 to 70% of all cases, and this usually develop in the extremities. Alveolar rhabdomyosarcoma, they are usually found in individuals between the age of 10 to 25, and they usually happen or occur in the head and neck area. And pleomorphic rhabdomyosarcoma, this type of RMS is usually found in adults. It can be further classified into classic, round cell, and spindle cell pleomorphic rhabdomyosarcoma. A system of staging or grouping is used to determine how far the disease has progressed or what will be the prognosis of the patient. The group staging system considers the extent of the disease and the completeness of the surgical resection. It is divided into 4 groups. There are 4 groups. Group 1, where the disease is localized and there is complete surgical resection and there is no nodal involvement. Group 2, there is some sort of nodal involvement and the disease is mostly surgically resected. Group 3, most of the disease is surgically resected, but there is more of the residue remaining in the site of onset. And Group 4, the tumor has metastasized. In the staging system, it considers TNM staging, which stands for tumor, node, and metastasis. Stage 1, the disease is localized and it involves usually orbits, head, and neck area. Stage 2, the site of onset is unfavorable and the size of the tumor is less than 5 centimeters. Stage 3, the size of the tumor is greater than 5 centimeters, and stage 4, the disease has metastasized. This staging and grouping mechanism is used to determine the risk of the patient. There are 3 risk groups: low risk, intermediate risk, and high risk patients. Diagnosis usually involves checkup for a abnormal lump or pain, which may lead to an X-ray or a biopsy. Imaging modalities such as X-rays, ultrasound, CTs can be used to diagnose. And biopsies, excisional biopsy is used if the tumor growth is small and can be completely surgically resected. If the tumor growth is larger, an incisional biopsy is used to determine what kind of rhabdomyosarcoma it is. Treatment involves surgery, chemotherapy, and radiation therapy. A combination of the above is used based on the type of rhabdomyosarcoma and the age of the patient. After surgical resection, if there is some sort of residual tumor in the site of onset, a combination of chemo and radiation is used to shrink the tumor. As most diseases, the prognosis depends on the time of diagnosis. If the tumor is diagnosed in an early stage, there is a higher chance of survival. Without treatment, patients usually tend to die within 1 year of diagnosis. For the case study, I used the case of a patient who is a 1-year-old boy, presented with obstruction in the mouth and pain. A biopsy was used to determine it as an alveolar rhabdomyosarcoma. The patient's parents refused any sort of radiation treatments and the patient died within 1 year of diagnosis. This was my research, and thank you for listening.